Right. Hello, everyone. Welcome to our second panel for this residency application panel series. Today we have actually a really interesting mixture of different incoming residents who have matched into different specialties. We have a huge range from emergency medicine to dermatology, urology, and neurology. So, would love to hear their journey. So I'm gonna kick us off with some individual introductions. So if you can just let us know a little bit of who you are, where you're from, where you're going for to start your amazing residency journey, and then we can popcorn to each other. So I'm going to. How about I start with Shade? We were both co-hosts of the podcast, so this is kind of reminiscent. Hi, Shade.
Hi, Zach. So I'm Shade. I'm originally from Jamaica and currently a final year student at Stanford, and I matched into urology at the Cleveland Clinic. And I'll popcorn to Mary.
Thanks, Shade. Hi, everyone. I'm Mary. I'm originally from India, grew up in Singapore, and then moved to Utah with my family about 20 years ago. And I'm currently a fourth year med student who matched into neurology, and I'll be starting residency at the University of Michigan in Ann Arbor. And I'm currently a med student at the University of Utah. I'll popcorn it over to Amelia.
Hi, everyone. Thank you for having me. My name is Amelia. I was born and raised in Montreal, Canada, which is where I'm actually calling in from tonight. I did my undergrad at McGill University and then did my MPH in New York City before med school, worked a bit during the COVID pandemic, and currently about to graduate from Medical College of Wisconsin. Matched in emergency medicine at Mass General Brigham. So I'll be moving to Boston at the end of the month. Thank you. And I'll pop it over to Chiamaka.
Hi everyone, and thanks for having me. I'm Chiamaka, and I graduated med school last year from Dartmouth, and I'm currently doing my transitional year in Boston. And I matched into dermatology, and I'll be starting my dermatology residency at UT Southwestern in Dallas this July. And I think that's it.
That's it. I'm still in med school. Takes a few years. Hopefully, I will get there. But I think thank you so much for everyone's introduction. I think, Chiamaka, your point kind of would like to get me started with the first question. You talked about something called transition year. So I think each of your residency structures are so different, and there are so many terminologies. I guess we can go down the list. How about we start with Chiamaka? Can you tell us a little bit of your residency structure? What does it mean by a transition year? What does it mean by going into, because people would think you match into dermatology, you go straight through. So we can go through each of the specialty and tell us a little bit about your specialty, and then I think the second question will be why you chose your specialty.
For the first question, this would take a while to really understand because I knew when you're just going one step at a time, I didn't even really
Mhm.
think about it till fourth year. But dermatology is one of the few programs, and I would say radiology, anesthesiology, certain residencies are included in this, where you have to match into two separate residencies. So your intern year, which is your first year, is always in, it can be for dermatology, in general surgery, pediatrics, or an internal medicine year. I would say a bulk of people who match into dermatology end up doing a general medicine intern year. But it's not uncommon for people who already know that they're interested in pediatric dermatology to match into a pediatrics intern year. It's less common to do a general surgery intern year. So your general medicine year, there are two ways you can go about it. You can either match into a preliminary intern year or a transitional intern year. The major differences between both of them is preliminary intern year is basically an internal medicine year. So you're basically doing ICU, you're doing how you act as a sub-I, your general medicine floor, maybe some emergency medicine, some outpatient medicine, but you're basically doing anything at nights that an internal medicine first year resident would be doing in that program. Compared to a transitional year, there are a few transitional years in the country that's important to note. Transitional years are usually geared towards people in our specialty, like dermatology or anesthesiology, because you get to see a little bit more of everything. I can speak directly to my transitional year. My transitional year, I so far have done a month of general surgery, a month of emergency medicine, a month of what we're calling ambulatory medicine, where I was in urgent care when I had my own outpatient patient panel. I got a few months of electives. So I got 2 weeks of electives, 2.5 weeks of elective, which I was able to do whatever I wanted to do. I had a vacation block, but I still had like 6 weeks of nights, 6 weeks of ICU. Right now I'm working in the inpatient medicine block. So you still have more of that, but they just give you a chance to do so many other things and see a little bit more than a preliminary year would give you. That's the major difference. And I don't know if you want me to answer the second question straight ahead, or I should let everyone go ahead.
Sure. Maybe we can go through the residency structures for your
Mhm.
particular specialty, and then I can ask the second question again
Yeah.
in terms of why.
Mhm. I can popcorn to Sade because I know urology has an interesting structure.
Yeah, sure. So for urology, programs are either 5 years or 6 years. The 6 year programs are ones that have a research year, which tend to be more academic programs. But your first year of urology, you go directly to urology. It used to be that you had a year of general surgery, but they've sort of switched it in the past couple of years where in your first year, you start urology rotations, but you still have 6 months of general surgery, and it's sort of interspersed. It's not like 6 months straight. They kind of mix it up, which ones you have. And then after that, your second year is completely urology. The program that I matched into, Cleveland Clinic, is a 6 year urology program, and the research year is in your fourth year. So it kind of nicely splits things up and gives you a break. And that was something that was really important for me as someone who sort of like likes to take the non-traditional path. I've taken so many gap years at this point, so it just felt natural to have that kind of pace in my residency program as well. And I'll popcorn to Amelia.
Thanks, Shade. So for us, it's a bit more simple. There's no transitional year required, but there is some talk right now about the 3 year versus 4 year program for emergency medicine. I will say for me personally, I wanted to do a 4 year program, which is definitely a hot take, but I wanted to go into academics later on. And like you both mentioned, most of the academic programs are a little bit longer, especially on the coast, I would say. And then for the general like EM applicant that goes to a 3 year program, it's extremely I guess adequate, I should say, but you might feel a bit rushed. So they did this study that showed that you need 3.5 years to get all the competencies required to be an emergency physician. So the 3 year programs are a bit more rushed. So less time for electives or vacations or academic pursuits. And then there was also this report that came out that in 2027, the ACGME is considering to require all programs to be 4 years. So there's some back and forth with the Emergency Medicine Resident Association, and that hasn't been finalized. But I have a feeling that, fortunately or unfortunately, depending on where you stand, that it'll be 4 years for everyone starting 2027. So Mary, I'll pop over to you.
Yeah, I think with neurology, we have a majority of our programs, or residency programs, tend to be categorical, which just means you can do all 4 years of your training at one institution. However, our first year is considered an intern year in internal medicine. And so we only start our neurology training starting from our second year. But with the benefit, if you're matching to our categorical program, you get to do it all in one hospital and you don't have to move twice. There are, I would say, maybe like 20 to 30% of neurology programs are still advanced programs, which means kind of like what Chimaka said, you would need to do like a prelim year in internal medicine, and then you would start your neurology training at whatever institution or whatever advanced institution you have like matched into. I will say what's been interesting is through this entire like process, I've noticed that there will be some programs that have both, that offer both advanced and categorical at the same institution itself. So if they have 14 neurology residents, maybe seven of them are categorical and seven of them are advanced. And so it's sort of interesting. And I remember when I was starting this whole application process, it was quite like confusing to wrap my head around this whole thing. But I will say what's been really nice with, I think neurology and ophthalmology tend to kind of be in the same boat where even if you are in an advanced program, they have linked prelim years, so you're almost guaranteed to do your internal medicine intern year at that institution, even if you get an advanced spot.
I add something because of what Mary said. Dermatology, unfortunately, is one of the few specialties that we don't have linked programs at all. Like at this point, I've not heard of any dermatology program that is linked. So unfortunately, you're basically applying to two different residencies, which
Mhm.
is double the money, double the double the interviews. It's very like you matching into a dermatology residency doesn't guarantee you matching into a prelim residency. They sometimes if a dermatology residency really wants you and you have a strong reason to be there, you can talk to them and you want them back, and they might be able to talk to the internal medicine program to see if they can match you together. Or obviously, you can try to woo both of them, but there's just no guarantee. So I would say majority of the people I know in dermatology, so many of them you can match in the same program and stay in the same state,
Mhm.
especially if you have ties to that state. But so many people end up doing it one place, like they might go back home or they might do in your home program and then match wherever dermatology residency takes them. So that's very important to know. And I know you're going to hear the word like categorical and prelim. Just know that prelim just means your first year, which is your intern year, which can just be a straight intern year or a transitional year. And categorical is your actual specialty of choice, which would be,
Mhm.
for my case, dermatology.
Gotcha. And then for these type of situations, I think you kind of alluded to it, is that you do apply to both at the same time, right? Are there any incidences where, let's say, you matched into the first year, but not your derm? So let's say I end up going to some place for my internal medicine residency, and at that year, I apply again to derm or any second to third, fourth years of the categorical ones.
We actually have people like I know in
Okay.
my program and around that happens to. Unfortunately, the match pans out how the match pans out, as we all know. So I think the most common case is that someone doesn't match into a dermatology residency, but they match into a transitional or just an internal medicine year. During that year, some of the benefits of that year is that you can end up deciding to just stay in internal medicine, and you can talk to your program director, and if they have a spot, they might match you as a PGY2. Or if you really, really are like stuck on dermatology, so many people reapply. You can
Gotcha.
even reapply twice again if you don't match the second time, and you just do a PGY2 and then match again. That happens all the time. On the
Hmm.
opposite flip side, you can match dermatology and not match a PGY 1 year. But with that, when that happens, there's something called the SOAP, which I'm sure we can talk about, but it's usually easier to SOAP into a preliminary year.
Gotcha. Yeah. So, okay. Now I'm going to transition to my second question. Imagine you have a potential candidate whose amorphy is undifferentiated, thinking about matching into a specialty of your four specialties. Kind of walk us through how you made that decision, like your M3 year doing rotation, or even before, maybe M1, M2, throughout your med school. How did you come about finding your passion and end up landing in the specialty that you choose go into and kind of make a case slash an advertisement for your specialty?
Yeah, I can go first. I think for me, one of the biggest questions that you have to ask yourself as an M3 when you're trying to decide where to go is whether you want to do medicine or surgery. And that delineation happens, I would say, pretty early on. But for some people, Maybe they like both. And for me, that was kind of the case where I sort of had this background where I was very interested in sexual and reproductive health. And for the longest while, I thought I was going to be an OBGYN. And then the good thing about rotations is you get a chance to explore those interests. And so when I had my rotation, I realized that I really like conceptually, I like sexual and reproductive health, but I don't think I didn't think that OBGYN would be the route for being able to explore that interest. And then fortunately for me, right after OBGYN, I had my surgery rotation. And I think some combination of luck or maybe subconsciously, I sort of knew these areas of surgery would interest me. But I had a month of colorectal, and then I had 2 weeks of urology and 2 weeks of transplant. And that sort of felt like the perfect combination to really show me that there were different sides to sexual and reproductive health, and that I felt like urology to me was sort of the gift that kept on giving. I think there's so many aspects of it that one thing with medicine that I didn't really like for myself is I never saw myself as someone who would be saving lives. Like I didn't like that grandiose idea of, like a physician. I sort of like the idea of being able to do something for people that would really improve their quality of life, that would help them live more meaningful lives. And I just saw so many instances in urology where you can do so much for people that really changes their daily lives. I mean, if you have someone with incontinence and they're like going about their daily life and they're just really wondering where the next bathroom is, or they're really afraid of having an accident, if you like put a sling in this person and improve their continence, like you've changed their life. They feel empowered and they're able to go out there and live a more fulfilling life. So once I was able to realize that, it was a very easy sell for me. And I think I also love the fact that with urology, there's medicine and there's surgery. So you could be an outpatient urologist if you want to be, or you could be like full on like surgeon and have like a little bit of clinic. And as like as you get a little bit older and your goals and aspirations change, for me, I think I'll want to be doing more surgery early on, but then things might change and I can decide to do more outpatient procedures. And I think it's very rare for you to get that mix in a lot of specialties where you get that mix of medicine, but you also get some surgery with it. So honestly, I really feel like it's the gift that keeps on giving, and I haven't looked back since I encountered urology. It's been 2 years and counting, and I don't think I'll ever look back. I'm really glad I didn't end up liking my OBGYN rotation as much as I anticipated liking it, because it really forced me to think about what other options there were out there for me. I think that's something I would say to applicants. If you're going to medical school with an idea of what specialty you want to do, maintain an openness to changing your mind. Because I've seen instances where people sort of like force like a square peg through a round hole, and that doesn't necessarily end well. And so if you're open and you sort of like let the process lead you, you'll land where you're supposed to land. And I really do feel like I've landed where I was supposed to land.
I can go next if that's okay. I 100% agree. Going into med school as the first person in their family to go into medicine, I had no idea what I wanted to do. I just wanted it to be related to public health. So I actually also came in thinking maybe OBGYN since the whole reproductive justice moving was going on. And then, went into third year again with an open mind, trying to explore different specialties and really being present on each rotation. That's the best advice I could give, is not only like worrying about evals and worrying about if you're doing a good job, but really observing, like, are the people around me happy? Can I see myself doing this? Just the lifestyle every day, the hours and little things like that. If you could pick up on, that would be really helpful in making the decision. I was also told by one of my mentors, like you mentioned, surgery versus not surgery, but then also like outpatient versus inpatient. Do you like procedures, things like that? And so I had kind of pivoted towards internal medicine because I got involved with the American College of Physicians in their health policy capacity, going to do some lobbying and work on Capitol Hill. And so then I discovered, all specialties can be related to health policy if you really think about it. So I took the third year elective just for my own curiosity. At my school, it was actually not required. And I really just, everything clicked for me. For me, I think it's the coolest part or the most fun part of every single specialty. It's the only time that you get to make a diagnosis on your own, or at least like get your first hands on the puzzle and sort of figure out what's been going on with this patient. And then more on like a mission standpoint, I think actually I know that it's the only place in the hospital where you can present regardless of ability to pay and regardless of documentation status or housing insecurity, food insecurity, when you name it, we see everyone in the ED. So that's what really attracted me to the specialty. And I think there's a lot of like-minded individuals that are more sort of for that first line mission. And unlike you today, I kind of love to run towards the fire. So I like that high stakes scenario. It's not obviously every day that you're saving lives, but yeah, I guess I like the adrenaline of not knowing what's going to come through the door and just being ready for anything. And then, of course, just to kind of go full circle, it intersects very well with public health. And I found a lot of mentors that do advocacy and health policy work who are emergency physicians. So I think it kind of fits well with that overlap. And you also have the time in your schedule to pursue sort of your side hustle or your academic niche just because of how the hours work. So yeah, I don't want to pop it over because I don't want to pressure anyone, but that's what I had to say for now.
I can go next. Yeah, I think both Shade and Amelia have like dropped such incredible like pearls that I kind of resonate with, and that was sort of how I guided my decision to end up in neurology. I did a bit of neuroscience research in undergrad, but I think neuroscience research and the practice of neurology and actually the patient population that you work with can sometimes can feel very far removed. So I didn't really know what a neurologist still did, and I think the whole practice seemed really daunting. I think there's like a term called neurophobia, and I would say I had some element of it coming into med school. I didn't really know how physicians could help patients with these like chronic, debilitating, sometimes devastating neurological illnesses. And I had a wonderful like neurology professor. We have a brain and behavior course and we call it the Renner effect, the Dr. Renner effect. And I was captivated at how he was able to kind of decode the seemingly very complex, complicated organ system into a very kind of logical kind of blueprint. And that's kind of when I realized, okay, maybe I should give neurology more of a shot. And I did some volunteer work at our local kind of homeless outreach clinic. And I saw how oftentimes specialty care can kind of be housed within like the pearly gates of academia, but sometimes specialists are the types of care that people need most amount of access to and timely access to. And so I really was inspired by this mentor to kind of consider neurology more seriously and also see how, even if I am a neurologist, I can do work in health disparities and improving access to neurological care. And so, come third year, I had neurology was like my third rotation. I had liked my OB rotation, but didn't really like the surgical aspect. I liked psychiatry. Psychiatry was my second rotation, but I found it to be a little too intangible for me to like see how my patient was improving. Like I wanted a lab value or a lab test or an imaging test that I could run to be like, yeah, my patient's getting better. And then I finally came into my neurology rotation. I think it finally clicked, and I just loved how every patient I was seeing, it felt like I was so interested in the pathology, but at the same time, I was fascinated by like, oh, I want to see this patient again in clinic later on. And I think that's one thing that I will say about neurology is it's definitely kind of more IM, but you'll realize at least when I did my IM rotation, I was like, my brain is a specialist brain. I like to focus on one thing, and I felt like neurology gave me that. But also at the same time, you don't have to decide right now if you want to be an inpatient doctor or an outpatient doctor. I think there's so much variability and variety that you can get within neurology. So there are people who will go through residency, and if they love the high acuity, can become vascular neurologists and work with neurosurgery and helping treat patients with strokes and getting them, through this really scary time. And then there's also neurologists who are movement disorder neurologists who are seeing patients with Parkinson's in clinic, or have their headache clinic or doing Botox injections in clinic. So there's really this wide spectrum of how the specialty can look like and how your practice can look like. And I liked that just as someone who was still kind of figuring out what sort of setting I want to practice in. And so I would say that's kind of why I fell in love with this specialty and why I'm really excited to be going into neurology.
All right, guess the last one will be the hardest sell is dermatology. I don't know how you're going to convince people to go to
Definitely not the
dermatology.
hardest sell, but it could be depending on your personality. But I would say, contrary to some people's thoughts on dermatology, like I came to dermatology late in the game. I did not consider dermatology till the very end of third year. And I know there's this advice right now that, and I would still give you this advice, like if dermatology is something that is on your mind as a first year med student, like it would be a good idea for you to start engaging with your home department if you have one, or dermatology in general if you have it. And I mean, if it's just in the back of your mind, you can always change your mind, but it will save you an extra year of doing a research year, or the stressor of wanting to get research and your numbers up if you even consider it. And again, you can always pivot away from it. When I first came in, I had a few things in mind, and I was actually doing urology research, and till I ended up doing getting to third year, and all those questions that we talked about came to mind. Again, just reinforcing what everyone has said. I think the biggest thing for me was once I knew that surgery wasn't for me and I was really a medicine girl, I decided on inpatient versus outpatient. And so many of the things, like one thing Mary said really resonated was your mentors sometimes do decide your path in medicine, because those are the people you look up to. Those are the people that make you feel comfortable. Those are the people that make you feel curious. So you're going to see that when you're going through your journey and you're asking this question, like whoever you're looking up to, whoever makes learning fun and easy, might be something you might gravitate towards. And I see some people, like if they have, I'm the first person in my family to get into medicine, but I see so many people. My friend who is a neurologist, his sister is a neurologist and he looks up to her. My friend who is an orthopedic surgeon, her dad's an orthopedic surgeon. So I look at my mentors, because I don't have other people in medicine, but family mentors, those people, like your favorite, like first and second year professor, whoever made that class so exciting, that person can be the person that really gets you going in that first few um, parts of your journey. But how I came to dermatology was I decided that, let me try out other things. During my elective block, I decided on dermatology. And I felt like when I really looked at what invigorated me, so when I come back from my inpatient blocks, I would, and that's happening to me right now in my transitional year. I would go to bed at 8:30. I was so exhausted. But after my dermatology blocks, even if it was like, an 8 to 5, and like clinic is busy, like most people think, dermatology is a chill specialty, but you really are working every single second you're in clinic, because we have 15, 30-minute block patients, and every single slot is filled up. But I would find myself coming home and I would still want to hang out with my family, might like talk to my friends, do something else. And I was like, maybe I should really think about this. And I really found that the dermatology department was so lovely. They were so inviting. They really welcomed me. They really so I was like, one, okay, this is amazing. Maybe if I was in a different institution with a derm program that wasn't very inviting, I may have felt differently. That's why all our paths really takes different shapes because of that. When I joined dermatology too, I considered something else, like I didn't see anyone who looked at me like me in the entire department. So there was no Black physician in the entire department. And I know that most people I know who were looking for dermatologists who were Black, brown, were really finding a hard time. So I really took that into consideration. Right now, only 4% of dermatologists are Black. So I really was like, I would love to add to that number. And even I'm Nigerian and I would love to take my skills back home. And we don't have a strong dermatology presence. Like, yes, we have an aesthetics presence when people think about skincare and hair care, but so many people have autoimmune diseases, genetic diseases. They have all these infectious diseases, and there wasn't a strong presence in these places. So I really wanted to be the one to get this expertise. I feel like it's such a privilege to go to a US med school and to get all this training. So I really wanted to be able to do that. Dermatopathology was also something I found very interesting. Like right now, if you send a pathology slide to a dermatopathologist in a group somewhere, that's going to cost you 5 to 10,000. So that's obviously something that we can't really afford in Nigeria right now. So it would be my privilege to be able to learn and go back and train dermatopathologists back home, or at least like start that process so we can be able to do that ourselves back home. So I really consider all of that. Another big thing as a Black woman, like hair loss is huge, huge, huge for us. And I know that some of the Black dermatologists I started to interact with were all hair experts. So I was like, of course we are. So I think that's also something I really wanted to do. Um, lastly, not lastly, but I ended up doing a research here in dermatology. Um, I I came into dermatology late. I already had research. I could have managed to not do research, but obviously, like I am someone that when I go into a process, I like to know that my odds are for me, not against me. So I decided to do research. But my research here really opened the world of dermatology to me. So many people like dermatology includes laser. Every single laser you use right now for even if it's hair loss, even if it's hair removal, different treatments, dermatologists are in the forefront of creating that. So if you're someone that is interested in physics, dermatology might be a pathway for you. Obviously, there's Mohs surgery. And if you're someone like, Amelia has mentioned, who is into health equity, there's so many places you can go. And as a Mohs surgeon, you can really help do fine surgeries on people with so much growth around, especially in rural America. So many people are sitting with huge BCCs on their faces that really, they don't have access to good Mohs surgery. So that's something you can use as your outreach. Obviously, you can be like the Mohs surgeon in a fancy place, but you can also use your that to go and do some outreach. Dermatology also, like skincare, skin cells. If you're someone who is interested into cell biology, skin cells are very easy to work with. They're easy to manipulate. So a lot of the things a lot of biologics we're working on right now, dermatology is at the forefront of that research because of how you can manipulate them. So most of the forefathers of some of our biologics are dermatologists. So if that's something you're interested in, academic dermatology might be for you. If you also like neurology, don't want to give up on inpatient, you can be an inpatient dermatologist. You can work, I know that so many big institutions, Dartmouth has one, Yale has one, OSU has one, Stanford, like they need inpatient dermatologists. When you come into the hospital, especially in a big medical system, so many people come in for another primary disease, but they're coming in with all the skin findings and they can't get into a dermatologist's office for 5 months, 6 months. So the residents are usually the ones seeing them, but we have an inpatient dermatologist that is usually Stephen Johnson's, all this other clinical dermatology. You can be you can be a specialist in that. So I really found like dermatologists to be very like outgoing, and my personality is very outgoing. I'm a chatty box. And I feel like if I'm not chatting every day with patients, I would wither away. So I just really had to have like that clinical aspect of it. So that's like myself for dermatology. Like I really hope that when people are thinking about dermatology, I think most people are thinking about it in terms of the aesthetic care. And yes, you can go into dermatology and you can definitely be into aesthetics and you can do just skincare. But so many dermatologists are needed for all these other complicated issues. And every day we're being trained to do that. And obviously, you can decide what you want to do in your practice. But hopefully, when you're considering dermatology, you should know that there are all these avenues.
Thank you so much. That was very great sell. So I think we're going to transition a little bit in terms of something that I think a lot of our listeners are super interested in is in terms of applying to residency as international student. How did the visa and administrative logistics impact your application? Because I think when we compare to us as US graduate, compared to our peers who are US citizens, I think a lot of this doesn't really come up until you are about to apply or thinking about applying. That's when visa issues or sponsorship comes up. Can you guys tell us a little bit of how did you start planning kind of the timeline of thinking about visa and logistics, the different types of visas, and also how did that influence your decision of choosing which residency to go into?
Yeah, so for me, I actually found someone who was like a fifth year urology resident at UCLA through F1 Doctors. Actually, I went on the website and like looked at the specialties and found saw two people in urology, and so I reached out to one of them. And one of the advice that piece of advice that she gave me was to actually start the process early and to figure out which places offer H-1B versus J-1 visas. So I sort of had a running list sort of going into the application season rather than like, after I submitted my as I was like putting together, the main application for the ERAS. So I sort of like had that in the back of my head that that would be like an important part of prepping for the application season and then to do some of the legwork in terms of figuring out like the H-1B process so that when you're in the interviews, I didn't necessarily bring this up myself in interviews, but in case they had questions about, visa, to be very informed about it so it wouldn't feel like work for the schools, fortunately or unfortunately. So that's what I did. I sort of had my list of places that sponsored H-1B versus J-1. I certainly had my preference about which one I would have wanted. Um, and so fortunately, I did come across several places that were willing to sponsor an H-1B, but there were also places that explicitly stated that they only offer J-1. There's actually one place I reached out to, and they said a J-1 should be sufficient. And I was like, okay, sure. So yeah, so that was like a big part of the process, just doing the research. You just have to do the research yourself. You have to be informed so that when you are applying and when you're doing the interviews, like you sort of have the cards on the table and you sort of like, know which way you want to go and you can you don't have to explicitly state your preferences to them, but you're making an informed decision when you're putting together your rank list, depending on how important the visa sponsorship is to you. And for me, it was important to me. So I sort of prioritized that in terms of how I would rank places. And I am going someplace that is sponsoring an H-1B visa. So, I'm grateful for that. But I would say do your research, be informed, and the F1 Doctors website is a really good tool to look for someone in that specialty and reach out to them because they've done the research already. You might have to like update the list, but they've done a lot of it for you and they can sort of guide you through it. And that was very helpful for me reaching out to peers who were further along in training and who knew the places that would, or sort of like knew had a general idea of what the lay of the land was in terms of visa sponsorship.
I guess to follow up on that, can any of you guys tell us a little bit of like, I think Shade alluded to preferences in terms of H1B and J1. I guess any of you guys can explain like what are the differences? And also, I think with H1B, a lot of times people will start their first year residency on OPT and then transition to H1B while you're in your PGY 1 year. And also, can someone like kind of explain that process a little bit if if that's the path that you're going through?
I can try to take this one, and please feel free to jump in, interrupt me if I'm saying something wrong. But I actually had like a total spiral at the end of M3 year because my med school actually did J1 and H1B for internal medicine, but not emergency medicine. So I was really discouraged and thinking like, is this going to influence my specialty choice? But of course, it would have been a huge mistake to just make a decision based off of that. So I think all of us are living proof that you can reach for the stars and make it happen whatever your dream specialty is. As an international student, I think nothing is out of reach, so you just have to be informed, like Shade said. So going over H-1B versus J-1, I actually met with an immigration lawyer at my school, which is really kind of them. And she basically explained to me that there's a lot of negative stereotype and bias towards the J-1, I would say. People thinking, because for those who are not familiar, after you do your residency training on a J-1, since it's sort of like a diplomatic professional training visa that your home country is sponsoring, you have to return to your home country after you're done residency for a 2-year service requirement. And so that can, obviously turn some people off, especially when it comes to board certification. Like, for example, I had inquired and I actually would have to done my step one and step two equivalent for Canada to do the J1 waiver. So that would have been just, extra work. But there are ways around it, and it's not impossible to do the J1 waiver. And that's the way that you sort of escape the home requirement. So, to my knowledge, after you're done residency, you can either work in a federally underserved area, such as like a primarily Medicaid serving zip code or catchment area for the hospital, VA type of employment, also like public health jobs as well. So, a lot of the primary care specialties are easier to get J1 visas for. Um, but I actually spoke to at least two people on the interview trail who were on a J1 waiver job after residency as faculty members. Um, and they were explaining that, it was obviously difficult, and I would say it's more uncertain, but it's not impossible to either stay or go back to your home country, whatever is best for you for the J1 pathway. The pro of the J1 is that it can be extended up to 7 years. So if you want to do fellowships and other things, that could be a way to stay in a similar status for a longer period of time, because the H1B is only 5 years. And after that, actually, I'm not sure on this piece of information, so please someone correct me, but I'm pretty sure after the H1B, like you can't renew it after 5 years. You have to go into a green card lottery, or sorry, we're lottery exempt, but you have to go for your green card afterwards. Um, but yeah, so those would be the pros and cons to both. I think everyone prefers an H1B because it's just something to kind of like close the book and not have to think about at the back of your brain, always thinking about like those 2 year home service requirement and J1 waiver jobs. So I'm also very fortunate that my program will be doing an H1B. And just wanted to say, like, it's not the end of the world. I even heard that you can, like, for me, like, you could like live in Canada and sort of like work and cross the border by land, which might be difficult now in this political climate, but that was an option that was mentioned by the lawyer that I spoke to. So those are the sort of pieces of information that I have for the pros and cons of the visa. But again, I think everybody is like fixated on the H1B, which is great. But like you mentioned, Zach, you have to apply for your OPT pretty early. So I remember I actually did a global health rotation in Nepal last month. And so I had to get my OPT approved before like beginning of April, because you can't travel while you're pending a status. So try to get the ball rolling for the OPT in January if you are applying for that after med school, which I think either way it's kind of wise to do, because it's you're entitled to that if you're on an F1 right now, to that 1 year OPT after you graduate. So yeah, feel free to add things if I missed anything.
Yeah, that was
Like with
great,
the
Amelia.
H1B or
Oh,
J1, I think getting your OPT started is a good idea. Like I waited to get my OPT application in, and I did not have my card till a week into my transitional year, which they just like used a vacation in the beginning, elective block, but that was very stressful. So definitely start applying as soon as your international student office tells you to, just send it in. Just don't think about the money, just do it. And a second for the J1 waiver. So I have a friend who got the waiver because it was like a hardship waiver because of her young children. So usually that's another way to you can get a hardship waiver where if you have a loved one who is an American citizen who is sick, husband, small children, or, like if you're being away from them will cause them such hardship. And the hardship isn't for you, unfortunately, it's for the US citizen family member, so your children or your spouse. That's a way to get a waiver.
The only last things I will add is I don't know the details of this waiver, but I don't know if it's called the Conrad 30 waiver. I think that's a specific waiver that if folks do end up on the J1 are wanting to do that home requirement waiver, they can kind of find out more details if they Google Conrad 30. I think most states do it. And there may be some stipulation of like working X amount of years in like a medically underserved area or a health profession shortage area. Um, The other thing that I would say for me, when I was looking just personally, like the visa sponsorship was sort of a deal breaker, whether or not I would want to rank a program or not rank a program. And the H-1B was really important also because it's a dual intent visa. So Amelia had mentioned that there's sort of like a time clock that you get the H-1B for 6 years. You get it 3 years at a time and you can renew it up till 6 years. And then by that time, you need to have a permanent residency application filed. And so if for folks who do have that goal of, permanently settling here in the United States, pursuing permanent residency or citizenship, the H-1B is a little bit more favorable just because you can start a green card application while you are on that H-1B visa because it's dual intent. Whereas that J-1 visa, you have to complete your J-1 visa and the 2-year home requirement or that waiver before you can even initiate a green card application. And so in my case, my parents are here, my two younger siblings are here, so I knew that I wanted to pursue permanent residency as soon as possible. And so that was important to me. And I would say the advice I would give is you sort of have to cast a wide net. And I'm really grateful for F1 docs because kind of like Sade, I met my neurology like F1 mentor through this website, and they were able to kind of share with me how they went about reaching out to programs. And what this mentor essentially told me was even before she submitted ERAS, she kind of emailed program coordinators at different programs just to verify the information about visa sponsorship because some programs are kind of vague about whether or not they would like explicitly sponsor the H-1B or they only do J-1. Sometimes they put that like term on a case by case basis, will evaluate H-1B. So for some programs, I did reach out to program coordinators before submitting an application. And if I heard back immediately of like, oh no, like they won't do it, that I didn't waste my money applying there. Um, the other thing that I will also say is this is kind of going to be contradictory to what I just said before. Sometimes there is like benefit to applying somewhere and getting your application, your name in front of that program director because when you ask them for an H-1B sponsorship, even before they know who you are, your scores, your like accomplishments, your research, whatever, I feel like they're more likely to maybe like not even want to advocate for you to see if they can do an H-1B sponsorship. So sometimes reaching out again to programs after you've submitted that application, being like, hey, I've got this interview invite. I just wanted to confirm, like, will you guys sponsor the H-1B? That can also be better just because now they actually have your file on deck and they can see like, oh, are you someone they actually are interested in and they want to like pursue this H-1B for? So that was sort of kind of my experience. And yeah, it was definitely kind of stressful going through the process, trying to figure out which programs will and wouldn't, but I'm really grateful that my current program is like willing to kind of bat for me and sponsor the H-1B.
Website that had the visas on it. And I'm sorry. I feel like I'm like so far removed that I'm just 1 year out. There was a website that had J1 or H1B or visa or no visa, non-citizen. And I made a list using that. Does anyone remember?
I use
Um,
the AMA list, but then there's
was it?
also
There's AMA and
The
there's
Frida?
another one. Frida.
Frida, yeah.
No,
And
Frida
when
is the
you log
AMA
in,
list.
Yeah, I just
yeah,
feel like
Frida
we
is the
keep doing
AMA.
like very repetitive tasks on each one of us. And I feel like it would have been such a nice place to like have like a coordinated attempt from like I guess AMA or AMC to like just keep this up to date so that we don't have to do this like begging slash advocating for yourself. I mean, case by case is different, but even just the programs I know we don't. It would be so nice to even have that. But I guess that is one of my, I guess my soapbox. But
You're
it,
so right because it
Residency
varies from website
Explorer.
to website. Sorry, go
Yeah.
ahead.
Residency Explorer. Like it's a had that information apart from the Frida AMA. And I tried to make a list based on both of that, but dermatology also had like a huge Google spreadsheet just because there are not that many programs and they had a visa, yes or no.
Mhm.
And I individually reached out to programs and I actually had a program come back to me, and this was the most bizarre thing. This person said, "Why would we sponsor a visa when we have so many applicants?" word for word. So
Well, I
he's
hope you didn't
no, I
waste
literally
your
had like
money to apply
17
there then.
interviews. It literally didn't make a difference. But I was just like, because I think I'm a good candidate, I didn't respond. But just so you know, there's some people that have biases towards
Yeah.
people who need visas because they're just like, why would I do the extra work when I can just get, a resident that doesn't. While there are some people, I had some residency interviews that they were like trying to advocate for their program by saying, hey, by the way, we sponsor H-1B visas. Like they were actually putting it out there. So
Hmm.
obviously those are you want to be able to have a good connection with
Right.
the program you end up in. So that's already a good sign.
Yeah. It's a great like confirmation bias. It's like it's good that they screen them out for me. I don't even have to screen them out. It's if you're not welcoming me, I don't want to be training in that environment, which is great advice. I guess I want to respect everyone's time. We have about 5 minutes. So I think we're gonna do like 1 point from each one of you about as you're going through your residency application process or the 4 year, like the last 2 years of med school, thinking about applying a residency. What is one thing that you wish you have thought of, you wish you have done differently, or things that you're really grateful that you did, and that's not a common knowledge to people that, oh, maybe check visa status early. So I think each one of you, if you can have just like 1 point that you can, try to broadcast to a wide F1 doctors audience.
Well, I feel like one big thing is just having people who will vouch for you, building strong relationships with your home department. Because I think a lot of, I mean, for especially small fields, like urology is a very small field. There's only like 300 something urology residents per year. And so just having people who will vouch for you, who know you, and will be able to like, talk to their colleague at this other place because everybody knows everybody. It's just really important, more so than all the like statistics or like all the stuff that you put down on paper, but just being a genuine person who wants to build these relationships and has a genuine interest in the specialty, that will take you really, really far. Um, I would say so. I mean, I did take the researchers that gave me a little bit more time to build those relationships, but you can totally do it in 4 years. And I think just being genuine about that interest and connecting with people, is really important.
I was gonna just leave um on the note of like empowering upcoming medical students of like I think residency application can seem very daunting. And I remember starting that process thinking, oh my goodness, this is going to be med school application 2.0 and like just remembering all the stress of that. But it really is different because you, as an applicant, have a lot of power in trying to screen programs and see, is this the right place for me? It's almost like they're trying to sell themselves to you just as much as you're trying to sell yourself to the program. And that was something that I didn't really realize until later on, towards kind of the midpoint of my application cycle this year. And so I don't know. I would just kind of urge applicants and current med students to be like, hey, you have a lot of agency. If you're like, trust your gut. If this program is not meeting your needs, you're not going to feel valued or excited about the work you're doing there, then know that there's going to be a better program out there. There's a better fit. And you can turn down a program, so to speak, if it's not meeting all your needs.
Yeah, 100% second that. I think, like you mentioned, applying to medical school, we're all like overly applying. We think that we have to be better than US citizens, but I think in this case, it's the opposite. I think that we have, a unique perspective and something to bring to the table as international students. So when you're drafting your application, just, hindsight is always 2020, but I certainly overly like over applied to way too many programs. And I know it depends by specialty. So maybe inquire about how many programs you should apply to for your competitiveness that level and do whatever makes you feel more comfortable. If you have the means to apply to a couple more, that's absolutely fine. If you want to interview at a few more, just because of the whole visa situation, then that's totally fine. But I think it all works out. And like you mentioned, Mary, you really have to go where you think that you're going to be able to thrive as your most authentic self and really trust your gut because I know med students love to like compare each other and contrast their experiences at different programs, but just really go with the vibes that you got. And especially if you're able to do an away rotation, for us, it's required in emergency medicine. And I matched at where I did my away. So I think that says a lot of like if you're able to see the program for a whole month and just get a feel for how you would fit in there. So yeah.
with everything. One thing I feel like I learned hindsight after match was that a lot of what happens on match day when you open your envelope happens like all the work happened before application day, before the day you hit submit application. Every single thing that really mattered on your application happened before. So really, like we said, you're making your list. Maybe trying to think about your 10 experiences. What am I going to put in my 10 experiences? Who are my mentors? Who is going to vouch for me? What programs do I want to? Sometimes actually reaching out to programs early on is a good idea, at least in dermatology, because these programs want to feel like you want them as much as they want you. So reaching out early, I've actually seen it work out for people where they're like, I have my spouse here in Connecticut. I really want to come to you. And they're already thinking about you early on. So like really think about your application before application season. Really think about who you want to present as a candidate before application season.
Yeah, that's super useful. And I think yesterday when we're doing the IM panel, a lot of the discussion was also like, is this a med school 2.0 application? Is it more chill? How is it chill defined? I feel like I think I want to reassure everyone who's listening on eventually is that this is definitely not a med school 2.0, but I think it comes with its own differences and its own like insights and perspectives. And I think hopefully once you go through a med school, you have matured, you have understood yourself a little bit better, to gain that insight. Um, so I want to respect everyone's time. Thank you so much for showing up for future F1 residents. We've learned so much, and I think all of these experiences are we will be able to use this to propagate the knowledge so that everyone can find their mentors, build their relationship and networks. And I think another shameless plug is use Alpha Doctor's website. You'll find your mentor, find your network, people to vouch for you. And with that being said, thank you so much for everyone's time. And now we have covered different residencies. We're going to have many more. So hopefully these knowledge will be further, future propagated on in the future. Thank you so much, everyone.